Hi, I'm Dr. Rod Kurthy, and I'm the developer of Deep Bleaching. And you're probably here watching because you've heard about deep bleaching. Maybe you've seen about it on the internet. Maybe you've had friends who've had it done. You've probably already heard that it is the most effective tooth whitening technique ever developed. But I imagine you have a lot of curiosity, you have questions, you have concerns. So I'm going to try and address any possible concern you might have. So it's going to take me a few minutes. Sit back, relax, and let's get started talking about it. Hi, I'm Dr. Rod Kurthy, and I'm the developer of Deep Bleaching. You may be at this website because you've heard that deep bleaching is the most effective bleaching technique ever developed. You're probably watching because maybe you have some concern about bleaching. You want to learn more about bleaching. Maybe you have some questions about bleaching, or maybe specifically it's about my technique of deep bleaching. I've practiced for about 30 years, so I pretty much know what your questions are, I know what your concerns are, and you're probably thinking that bleaching is unpredictable, it's painful, you have to give up drinking your coffee, your tea, your red wine. It doesn't last very long, so why bother in the first place? Well, you're going to learn today that deep bleaching is an entirely different category. All of those concerns are not concerns with deep bleaching, and I will address each and every one of them. First, let's take a look at some typical results of deep bleaching. Now, I'm going to be going through these very, very quickly because obviously on a video, on a website, we don't have a lot of time. So anytime you want to continue looking at a bleaching case for longer, hit your pause button on your video. Now you can see the amazing color differences. These are typical cases. These are not the unusual ones. This is what you typically can expect from deep bleaching. Amazing, isn't it? Now here, what I'd like to show you is one of my deep bleaching patients. She's very close to me because she happens to be my daughter. And these are mock-ups that you're going to be watching here of posters and things like that for deep bleaching. And I want to let you know that she actually had her teeth deep bleached about 6 years ago. And there has been no retouching whatsoever of these pictures. These are her natural teeth. And we're going to discuss this in a few minutes. So why does deep bleaching work so well? Well, it works well because it restores your tooth's ability to absorb oxygen from the bleaching gel. This is what whitens the tooth. As a teenager, your teeth are incredibly absorbent of oxygen. As you get older, oxygen will not penetrate your teeth nearly as well. That's why my daughter's teeth that you just looked at are so beautifully white, is because we did deep bleaching when she was a teenager. Absolutely amazing, and they will stay that way the rest of her life. What happens is oxygen that is given off by the bleaching gels will penetrate into the tooth. And with deep bleaching, they will be able to penetrate deeply into the tooth. Not only deeply into the tooth, but deeply into the individual crystals, thereby really making a huge improvement. With any bleaching, what happens is that the oxygen that gets into the teeth breaks up long-chain stain molecules. A long-chain stain molecule will reflect light as a darkness. A short-chain molecule will reflect it as a lightness. So when the oxygen breaks up the long-chain molecules, your teeth get lighter. Let's take a look at another case. Absolutely amazing result. Now, one of your questions is, how long does it last? How long does deep bleaching last? Well, again, I mentioned that deep bleaching is the most effective tooth whitening technique ever developed. It is so profound, so effective that it is a permanent technique as long as you perform a very simple maintenance at home. You'll be 90 years old, walking around with your cane, and your teeth will still be the same color. Absolutely amazing. Let's take a look at another case here. Just look at the amazing result. Another question that you have is bleaching safe? Well, bleaching has been performed on millions and millions of patients without problems. It's been shown to be totally safe for teeth and gums. I have clinically tested and developed bleaching system products for my deep bleaching for the last 4 years. And we have developed products that work specifically with the deep bleaching technique. They have the proper physical properties, the proper viscosities, proper solubilities. All this has an effect. We've also developed a system that's low in sensitivity. So overall, everything considered, yes, it's amazing that we can get such amazing changes in the tooth color with absolute safety. Now let's take a look at another case here. Again, just imagine that you talk about happy people. With other techniques, you're not typically going to see this type of a result. I know that another question that you have is regarding discomfort from bleaching. You've heard about it, maybe you've experienced it yourself. In certain cases, it can be quite severe. Well, that is the main reason why I've spent so much time trying to develop a product that causes little sensitivity. And we've done it. And it is very, very amazing. What I found in my clinical testing is that 2 out of every 3 people experience no sensitivity. And the 1 out of 3 people that do experience sensitivity have told me that they have only experienced no more than 10%. How do they know this? Well, in the testing, we do what's called split arch testing. We do one thing on one side of the mouth, one thing on the other side of the mouth. So when other typical bleaching products are used on the left side, and our test products were used on the right side, it was very easy for patients to compare what they felt on one side with the other. So you're probably saying, well, gee, this means I can absolutely have my teeth bleached with no discomfort. And my answer would be probably so. However, I don't want to mislead anybody. You still may have a little bit of sensitivity, and there are those very, very rare cases where some people will have, for instance, over-the-counter white strips that they'll place on their teeth, and after only 3 minutes, they're in tremendous pain. Well, if you only had 10% of that, but yet you were bleaching very, very thoroughly, you're still going to have some discomfort. So chances are you're not going to have any, even if you've had discomfort before. But if you are one of those extremely rare cases, the good news is that there is likely no other technique that you could bleach whatsoever. So with other techniques, you might not be able to bleach at all. Whereas with our new deep bleaching products, you may experience a little bit of discomfort. Your dentist would alter the program to fit it to your needs, but you will be able to get your teeth whitened even if you are one of those extreme rare cases. Now, what you're looking at now is an electron microscopic photograph of the surface of a tooth. Now, the little holes that you see are not just holes, they're tunnels. And they lead from the outside of a tooth all the way to the nerve. Now, if you look at the 2 that have red arrows pointing to them, these are open. And that means that this can create sensitivity. But now look at the ones that are plugged up, the ones the blue arrows point to. That is the way your tooth normally should appear. All of these holes, all of these tunnels should be plugged up like that. Well, typically when you bleach, the bleach cleans the teeth so thoroughly that it cleans these little plugs out, and that's why people experience sensitivity. Well, with our new system, the desensitizers that we have artificially plug up these holes, and it is very, very effective. Now, another question you might be asking is, what about age? How young can we bleach? How old can we bleach? Well, the younger we get to the teeth, the better. Age 14 is ideal. The baby teeth have fallen out, the permanent teeth have come into the mouth, the patient is still very young, and you get an unbelievable result, just like you saw on the photos of my daughter. The younger a tooth is, the better it absorbs oxygen. And when you combine that with the deep bleaching technique, wow, you get a brilliant, brilliant result that will last an entire lifetime with proper maintenance. Old teeth, on the other hand, are very, very difficult. Gee, even starting in your 40s and 50s, it starts to become a lot more difficult. And when you're in your 60s and 70s, well, many dentists just won't even attempt bleaching teeth on patients that age. Deep bleaching is different. It rejuvenates the teeth and makes them respond as they would have at a much, much younger age. And so even if you are 85 years old, you're still going to be able to get a brilliant result. Absolutely beautiful. Now let's take a look at another case. Look at that. Look how gorgeous the after picture is on that. Just beautiful. I'm sure another question that you have is, how white will your teeth get? Well, we really don't know for sure, but what we can say is that it will be a major color change with deep bleaching. Deep bleaching is the most effective technique ever developed. In fact, it is the only recognized technique that will even bleach tetracycline stained teeth within a short period of time. This was previously thought to be impossible. Tetracycline is an antibiotic that when taken when young, teenager or younger, sometimes even in the early 20s, can permanently stain the teeth, and it can be bad. You're going to be seeing some pictures coming up of some very amazing cases. So it is the most effective technique ever developed. It is beyond comprehension, so let's take a look at one of these cases. The case you're looking at right now is a tetracycline stain. Look at the enormous difference between the before picture and the after. Again, no one ever thought that this was even possible before deep bleaching. If it can do this on a tetracycline stain case, you can imagine what deep bleaching is capable of on just a typical bleaching case. Take a look here. This is a patient that has a bit different of a presentation of tetracycline staining. This is what we would call a banded case, and it all has to do with how frequently the patient took tetracycline, what dosages they took, what ages, how much time there was in between taking tetracycline. But this patient had a definite dark band across the middle of the teeth and an overall gray appearance. Look at the result. Isn't that amazing? Now, this case right here is courtesy of Dr. Howard Goldstein. This was his first deep bleaching case. What you're looking at is upper teeth that had veneers, porcelain veneers, placed over them to hide the tetracycline staining. This patient preferred not to have veneers placed on the lower teeth. So Dr. Goldstein decided to try deep bleaching as his very first case, and look at the tremendous effect that he had on those lower teeth. Now here's another patient with tetracycline stains. Just look at the before and after. Absolutely amazing. There's a close-up of it right there. Now, if you look carefully on the before picture, what you're going to see is somewhat of a gray band across the middle of the teeth. It's totally gone after we were done. Now here is another tetracycline case. This is by Dr. Stephen Glass. This patient, again, a typical banded tetracycline case. And again, this is a typical case that dentists would have never attempted bleaching because they would have known that it would have no effect. Deep bleaching, obviously, you see the result. Now, this may be one of the worst cases I've ever seen. This patient was obviously very distraught. Dr. Mick is the dentist who performed the deep bleaching. This was Dr. Mick's first deep bleaching case. Just imagine the change in this patient's life. Now, in the after photo, you see some dark little areas there. Those are old fillings. And that's something that you need to be aware of, that any fillings that you have, any porcelain that you have that shows, will not bleach. And so after bleaching, you'll have to have those redone. But if it's minimal, like these are, it's not a big deal.